Welcome back. This is Good Morning Namibia. Now, for nearly 3 decades, Chinese medical teams have supported Namibia's public health sector by providing alternative and complementary treatments for thousands of patients. At the Chinese Acupuncture Clinic at the Intermediate Hospital Katutura, therapies such as acupuncture have become normalized and institutionalized, transforming thousands of lives, with more than 21,000 patients treated since September 2024 alone. This morning we're joined by Doctors Huang Qing as well as Dr. Chao Tsugang to tell us more. Good morning, doctors, and welcome to Good Morning Namibia. Dr. Guang, did I do justice to your surname?
Yeah, my surname is Huang.
Huang.
Yeah.
Very well.
Yeah.
And I did justice to yours, doctor?
Chao Zukang.
Very well. How are you doing this morning?
This morning, good.
Yeah. Are you doing well, doctor?
Yeah, very nice.
Yeah. Talk to us about how this tenure has been, seeing that you're about to wrap up your time here in Namibia, doctor.
I think it has been a credible, honored, and profound responsibility. Yeah, you know, looking back on these 18 months, I believe we have been building the bridge of the health and the trust. We didn't come to listen to treat the patients. We also come to listen, come to stand the local health challenges, and to offer solutions. Yeah.
What are those challenges that you encountered, doctor?
Yeah, the health challenges here, you know, it's on my side. I think there are some people, you know, it's far away from the hospital, and you know, some of them they don't have the awareness of the health. Yeah, something like, you know, they didn't know how to control the blood pressure and the sugar level in many. So that's what we have seen and we have been done for the patients. Yeah.
Dr. Chao, what has your experience been for the past 18 months?
18 months.
Yeah.
In 18 months, there are too much problem with the pain. The pain such as lower back pain and the headache and the neural system problems, for example, the stroke and the facial weakness, because the acupuncture is good at treating the problem, the pain and the neural system problems.
Very well.
Yes.
Dr. Guang, how would you describe the impact that you and the team had on Namibian patients?
So as I said, it's a great honor for us to serve here because I heard of the Chinese medical team in 2005. That was my professor. Yeah, came to here to Namibia as a captain of the maybe the eighth team. Yes, and they do their job very good. So that means during this time they already has a seed in my heart. So I think it was 2023. I already know we may have an opportunity to serve here. So you know, when during our clinic work, you know, when some people come to see us in pain, but leave with a smile, yeah. So that means I'm so warm also in my heart. Yeah. Yeah.
Dr. Chao, apart from acupuncture, you also introduced an exercise technique.
Yes.
Please speak to us about that.
You know, we stay in Namibia, we introduced the Baduanjin to the Namibia people. But Baduanjin is a traditional exercise in China and is very popular among the people. Everybody want to have a long life, also with Chinese people. So we explore some methods to make the people have a long life. At least, at the end, we find the Baduanjin, this exercise can promote the circulation of the blood and strengthen the people and make the people have a long life.
We're not asking you to demonstrate the exercise, but how does the exercise work? Please explain it to us.
The exercise can promote the blood circulation and strengthen the body.
But how does one do it? How does one execute it? What does it look like?
It looks like the yoga. Look like the yoga, but it's from the China.
Very well. Dr. Guang, we understood that there were long lines. People wanted to see you all the time. What does this say about the demand for traditional Chinese medicine and intervention? Many people, many Namibians came to you for help.
Yeah.
So it shows that there's a demand.
Yeah.
What do you make of that demand for Chinese medicine?
Sorry, cannot understand.
Many Namibians came to the hospital to see you. They wanted more of your services.
Yeah.
So Namibians truly bought into the services.
Yeah.
They want more Chinese traditional medicine.
Yeah.
What do you make of that?
Normally,
Is your heart okay?
Yeah. I'm trying to understand your question.
Yes.
Yeah. But, 怎么翻译来着?
Yes.
How to use the...
Yeah, so there's a strong demand for the uptake of the services.
Yeah.
What does this say about the acceptance and the trust that Namibians have in traditional Chinese medicine?
You mean my commitment?
Namibians took strongly to the medication.
Yeah.
There was a strong demand. What does that say about the acceptance of Namibians, the trust that they put in you? Would you like to perhaps contribute to that, Doctor?
So, the trust is each other. You trust me, I trust you. So the trust, we are doctor, the trust must be from the patient. When we treat the problem, they have the problem to the clinic. For the pain, for other problem, we treat the problem and cure, and the pain will gone. And the patient, when they smiling, the trust will construction.
Yes.
Yes. So
that means
the trust is
sometimes,
from
Yeah. Yes, Doctor?
Yeah. Actually, that the high demand of the acupuncture, that means, the acupuncture is no longer the falling concept here. Yeah. But actually it has been a trusted option. Yes. So we are so glad to see that some people show their openness, and they are willing to wait or seek our health care. I think it's the highest compliment that we could receive.
Indeed, indeed. Now, Dr. Chow, as you prepare to wrap up and leave, how do you envision traditional Chinese medicine complement Namibia's public health sector?
Complement. 评价. 赞扬.
How do you envision traditional Chinese medicine continuing to complement Namibia's public health care system?
Okay. 就是这个 our team now we are leaving, and the next team is on the way. So the team is one team by one team. We will continue our mission, and our friendship is a long long time, long standing.
Yes.
Yes, and besides this, we can send the doctors and the teachers to Namibia to teaching the students of the medical clinic. And then Namibia also can send the student to China. Yes, they can learn the traditional Chinese medicine. Except that, we can do some research on the Namibia herbs. For example, so I know the devil's claw. It's very useful and popular in Namibia. We can do some research on it and make it more useful.
Absolutely.
Yeah.
And Dr. Guang, as you prepare to officially hand over to the next medical team, what key systems, skills, or knowledge are you prioritizing to ensure continuity of the care after your departure?
I would like to emphasize that, each team member carefully selected by the Health Commission of Zhejiang Province. And actually, each medical team members are very outstanding in their field, even in their hospitals. Yeah, so that's why we can undertake this job, this work here. And and the other things I want to show is we will follow up the blueprint. Yeah, it's very important. Yeah, we will share some information, like some profile of the patients. Yeah, maybe they who need ongoing treatment after we depart. And we also want to share with our incoming members.
The colleagues?
Yes, the colleagues. Actually, we are from different hospitals, yeah. But we will share our, some good experience, some what we do here, yes, and ask them do the same. And but they are also very outstanding. They have their own experience, but they also can explore more here.
Thank you, Doctor. Thank you. Thank you very much for your time. Thank you for the great work that you and the colleagues did.
Thank you.
And we look forward to more collaboration.
Thank you.
Yeah.
Okay.